Today I'm going to talk about Nipah virus, and this might be something that many people have not heard of, but it is an important virus and it's in the news. So Nipah virus is not a direct threat to the United States or much of the developed world at this time, but it is a virus that is really important to watch. It comes from a family of viruses that includes viruses like our normal respiratory viruses, like parainfluenza virus. But what's interesting about Nipah virus is it's an emerging infectious disease that was first identified in the late 1990s in an outbreak in Malaysia, where people got brain infection or encephalitis after working with pigs. And there was no person-to-person spread at that time, but it was a disease that had a very high fatality rate of around 30% with severe manifestations of brain infection. Cases occurred in Singapore after that, and people thought about it as something that didn't transmit efficiently. But all of that changed when major outbreaks occurred in places like Bangladesh, the Philippines, and India, where there was person-to-person spread. In these cases, in particularly Bangladesh and India, there was no pig involved. But we know that the host of this virus, the reservoir in nature, is flying foxes or a type of bat. And what happens is bats like to drink something called date palm sap, and people collect those with these devices on trees, and sometimes after the bat eats the date palm sap, it pees into the collection vessel, and then people are exposed to the virus through the urine of these bats. And in these cases, person-to-person spread has occurred primarily to healthcare workers in hospital settings. And because there's no antiviral, there's no vaccine, and it causes such a severe manifestation and comes from a family of viruses that we know can sometimes spread between person to person efficiently, this is one of our more dangerous biothreat agents that we watch right now. This outbreak in India has several cases diagnosed, but there are a lot of people under quarantine, and it's spooked some countries like Taiwan, for example, in Thailand, to set up airport screening, looking for fevers, looking for symptoms in people that might be coming from those areas. It's unlikely that we're going to see spread outward, but it is something we need to be prepared about. And I don't think that Nipah is a pandemic threat, but what I do think is that viruses that are adjacent to Nipah may have the ability to spread more efficiently from humans. And so that virus is really important to track. And if you like movies, the movie Contagion, it's a Nipah virus-like agent that's portrayed dramatically in the movie Contagion. But that's a little bit about Nipah virus, which you might read about in the news.